Hey everyone, we're back with the assembly style question. We have a 7-year-old boy that develops muscle cramps and tingling around his lips one day after undergoing thyroid surgery. Physical examination shows twitching of the facial muscles when the facial nerve is tapped. Which of the following abnormalities is most likely present? A. Hyperkalemia. So that's going to be wrong here because usually the findings are weakness, muscle weakness, arrhythmias, or peak T wave, which you can't see here. And it will be caused by things like renal failure, acidosis, cell lysis, so tumor lysis syndrome, and it can be a side effect of ACE inhibitors, ARBs, or case-sparing diuretics, so like spironolactone, for example. So yeah, A is wrong. B, hypernatremia. So that can be caused because of by dehydration or diabetes insipidus. Um, the findings would be mostly thirst, confusion, or seizures sometimes. So you can see this here. Hypocalcemia. So that's going to be your correct answer. So this is typical MBME question. After thyroid surgery, you find the muscle cramps and the tingling around the lips with the twitching of the facial muscles when the facial nerve is stopped. So AKA Schwarzschild sign, which is basically when you tap the face, you get a reaction like this. Anyways, they can talk about Trousseau sign as well, which is basically putting a blood pressure cuff on the hand and then you get a spasm at the level of the wrist. So that's typical for hypocalcemia. Uh, it presents pretty quick. It can go from hours to one day after thyroid surgery because sometimes you can after the thyroid surgery, the blood supply to the parathyroid glands could be cut off, or the parathyroid glands could be injured. So that's why it happens. PTH is dysregulated, and yeah, that's it. That's it for the right answer. So let's continue. Hypokalemia. Hypokalemia could present in vomiting, diarrhea, diuretics, and taking too much insulin as well, because insulin shifts the K plus to the cells, so from the blood to the cells, so you can get hypokalemia because of it, and it presents usually with weakness, cramps, and U waves on the EKG. Now, the last one, E, hypothyroidism. So this one could be tricky because after the thyroid surgery, first of all, I never said it's a total thyroidectomy, so you can't just assume. And usually they would be started on levothyroxine, so hypothyroidism shouldn't be a problem now. And we have enough um, like we have enough thyroid like T4 stores in the blood, so it wouldn't present directly after the surgery. Can present weeks to months after the surgery, and the presentation would be different. The patient would present with like fatigue, weight gain, cold intolerance, stuff like that. Yeah, thank you. Can you tell me in the comments what would happen if you fix hypernatremia too quickly? Thank you, like the video, and check out our YouTube channel.